How does it feel for me? Emma and Adam's update, November 2021. How have you been over the last 3 months?
I was deteriorating mental health-wise, and my care coordinator was rude before she left and tried to put stuff in place, but none of this materialised. So this last month it's been trying to navigate finding a way to get some more help, but not succeeding at kind of any point really.
How was your experience of trying to get help from the Harrogate Community Mental Health Team?
The care coordinator made an appointment for a duty worker to call you, and then they never called, even though Emma waited all day for them to call. And then the week after, I tried to chase up why they didn't call with the reception to find out what's going on, who then got in contact with Emma's psychologist, who she sees once every 2 weeks, who then rang Emma, misunderstanding the reason why I'd rang, asking if Emma needed any help, or if she wanted care coordination, still wanted it or not, despite her previous care coordinator saying very specifically Emma still needs a new care coordinator whenever that person becomes available. And then that kind of it got all very messy. She did arrange for Emma to speak to a duty worker the following day, who then got back in touch with the psychologist and said, I have some concerns about Emma. And then, even though the duty worker had expressed those concerns, again, they hadn't been picked up again. And then you had an appointment with the psychologist on the following Wednesday.
And Adam had to come with me because I was mute.
So we spent an hour of this really quite precious resource of an hour of therapy, trying to explain away the previous week of misunderstanding and miscommunication and incorrect ringing of who did what and why the duty worker didn't ring in the first place, and trying to almost cover the backs rather than addressing the right here, right now, Emma's not talking, she's clearly not okay stuff.
I kept writing on my phone, I don't want to talk about this anymore. I want to, I don't care anymore in this session that you didn't ring or somebody didn't ring. I just want to know where we're heading now.
Yeah.
Right now.
And then, almost like something out of a sitcom, the therapist basically got up and said, right, time's up. And then she almost very abruptly got up and walked to the door and to show us out, basically. Almost like she was angry with us.
That upset me as well, because I didn't understand. I thought she was annoyed.
Yeah. I said to the psychologist, I'm not happy leaving right now as Emma is, because she's clearly not well. So I was like, what can we do? And she's kind of like, well, I suppose you can see a duty worker. So I went to the reception, asked, can we see a duty worker, because Emma's really struggling at the moment. And thankfully there was somebody available, so we were happy to wait. Obviously, and she came and spoke with Emma for up to an hour and talked about what we're doing right now. We went through all the situation, and then the duty worker listened to that and it offered, like, what are you doing today, what's the plan for tonight, and we explored some options, because crisis team is a difficult option for you given previous history.
So when I made the decision that I didn't want to have to go for a psychologist to get referred, I said, can we ask if we can see the doctor instead? Because right now I will agree to do a medicine increase just for a short while until it gets a bit better. And so Adam rang up about that, and they said, well, we can get you to see him in about 4 weeks. And so I was just like, there's no point in that 4 weeks. But they wouldn't even let my GP. I had to wait for this appointment in 4 weeks' time. I couldn't even go through my GP and get it sped through. And I don't understand that. The whole point of when I've been in services, the whole point is that you need to reach out before you do something. You need to get the help before something happens. And then in reality, when you try and do that, there's nothing for you. You can't do anything before it happens.
Did you feel listened to?
The duty workers and the psychologists kept saying, you're stronger than the voice. Like, he can only get you to do stuff to yourself. So if you end up doing something, it's only you that's had that power, not him. I find it hard enough to explain. I can't explain to people why I have to follow something that's only in my head and I know can't physically hurt me anywhere else. It's very hard. How are you meant to reach out to someone for help in services for saying that you're struggling and you can't cope with the voice, when their only response is be stronger than the voice?
And how am I going to do that? A conversation with your psychologist, when it got all messy, they kept talking about like preparing for discharge and stuff like that, but no one's had the conversation about what we've had. That conversation last November about what we need to achieve, what Emma needs, but they've not done that yet. but then we're talking about it again, like we're getting ready to
when
do
you're
it.
in crisis as well.
Like, well, yeah, it's like, well, you've not even, you've set, so you've asked us what the outcomes need to be. You've not worked on the outcomes, and now you're saying, well, we've done it. And like, no.
And she kept asking, "Can we get Adam to leave?" She didn't want you in that appointment. She kept saying, "Can I just get to speak to you on your own?" It's like, no, I want Adam here because he can speak for me and he can also help me reality check after the appointment. We've had people who seem to be pleasant and kind and stuff. It doesn't feel like they've actually listened to what we've been trying to get help for.
Are services joined up?
My old care coordinator was helping us get a referral to Leeds Perinatal services, kind of support us on how to make an informed decision on like the kind of our future really. And then because my care coordinator left, I don't know where that referral's gone now. So you're meant to hear, I think, within 2 weeks. I've not heard, so I don't know if it's been sent or anything. I would have expected to have been referred to the Harrogate one, which is joined up with my CMHT team and my care coordinator and all my mental health notes and everything. But they tried to refer me to the Harrogate one, and I was told I'm a Leeds patient, so I have to go to Leeds Perinatal mental health perinatal services, which is a little bit confusing, to be sent to a different trust who doesn't have any notes on me, historically have never asked for my notes from Harrogate when I've been for them. So like when I had my Leeds autism diagnostic services, my referrer was Harrogate, but they didn't even ask for any notes or even why my referrer was referring me, because it was too difficult to get the notes from Harrogate. So it's very worrying to me that I can't be seen by the perinatal team attached to my mental health team I'm already with, and they have to be sent somewhere else.
If you could have changed one thing to make your experience better this month, what would it be?
I think if we could change one thing, I think it's about hearing what we say, but then acting on it and not getting wrapped up in the bureaucracy of, the criteria and all that sort of stuff. Just do stuff, because that delay can have a profound impact on someone's health and well-being.
Yeah, I don't understand why it takes so long, why everything has to be so delayed till you can actually get some proper support.